Well, I guess I can trace it back to the HIV/AIDS epidemic in the U.S. We were very much involved in research in that arena when there was an outbreak of MDR-TB in New York City. And that was a big wake-up call for the world and for the U.S. that in fact there is a big risk of tuberculosis that can affect urban centers as well as other places around the world and within the U.S. borders as well as developing countries. This was in the early 1990s, and the impact was pretty dramatic in that it provided an exercise in the capability of public health services to both identify infection, contain it, treat it appropriately, and prevent it from spreading. And it was a huge effort in the 90s. At the same time, it also brought to light the fact that much of the research and much of our knowledge about tuberculosis had really diminished over time. And there was a lot we didn't know, and we didn't have the sanatoria in place, for instance, anymore, or specialized facilities to house infectious individuals. And so that really got a lot of people thinking. There was the realization that TB was not a disease of other countries, but in fact could happen here. It did happen in association with the AIDS epidemic and with homelessness in the United States. And so because of that, NIH and other agencies involved in research and in prevention of disease, such as the CDC, realized that we needed to ramp up our own knowledge of TB and our own commitment to research. And so we did do that over the next 20 years. We funded a greater number of investigators and really began a great increase in our scientific knowledge of the background. I guess awareness of TB is something that's a little bit, unfortunately, not well disseminated. I think there have been some news articles that have brought tuberculosis to bear in the public's mind. I think asking questions of medical staff and reading more about it would be helpful, because with that knowledge, there could be a campaign to make certain that there's adequate funding available to really increase the amount of research that will lead to new drugs and new protections for the public. The most important thing, of course, is to talk to representatives in Congress. My number one activity right now is trying to make partnerships happen. I think they'll be especially important for tuberculosis because it's a global infection. Everyone is susceptible, really, around the world. And in order to really combat it, we need to bring to bear all the experts that we know of throughout the world, not just in the U.S., but in Europe and in Africa, South America, the former Soviet Union. There's so many pieces of expertise that if we work together and collaboratively, I feel we'll have a good chance of solving this problem.